celebrating Black History Month. Mr. Christian King is a Vice Chairman and Councillor at Large for the City of Worcester. He's also a social worker for DCF, and in his role, he's actually the Vice Mayor of Worcester. So put your hands together and welcome Mr. Christian King. As a man of many firsts, in 2016, Mr. King became the first African-American man to serve since 1936. The first African-American man to ever be elected citywide, is the longest serving elected official of color in Worcester's municipal history, and in 2024 he became the first Black Vice Chair of the Worcester City Council. He's also a co-founder of the Black Families Together, a Worcester organization that addresses systematic racism. He's also co-founder of the Black and Latinx Municipal Caucus, a statewide group of BIPOC elected officials. Councillor King is serving his 5th two-year term as City Councillor at Large in the City of Worcester. Next we have, Ms. Maheda James. And Maheda is an Assistant Commissioner for CYF Services for the Department of Mental Health. Welcome, Ms. James. Next, we have Mr. Moses Osagi, who is a substance use clinician and Senior Interim Director at Open Sky. Next, we have Ms. Sharon Tate, Director of Family Driven Practices in the Southeast area. Welcome, Ms. Sharon. And we have Ms. Teresa McIntyre, who is also a Director of Family Driven Practice in Metro Boston. So we're going to just have a conversation this afternoon. So as you can see, we have a wide range of individual, wide range of experiences here. We do have a lot of questions for them, but we're not going to get to all of them this afternoon just because of time. So we just want to have a conversation, but there's some questions that I want to ask that is related to everyone. First of all, I did a brief introduction, so can you all please take some time, a few moments, just to introduce yourselves and your role a little bit more. You have the microphone, so please, would you start?
Good afternoon, everyone. My name is Teresa McIntyre, and I'm the Director of Family Driven Practice for the Metro Boston area. I'm glad to be here today. In my role, I'm deeply committed to helping families. I also have lived experience with supporting my daughter. And I'm just glad to be here, and I'll tell you a bit more about me later when I share my story.
Hi everyone, my name is Sharon Tate, no relation to the actress Sharon Tate. That would only be applied to those who are over, a certain age. I am the Director of Family Driven Practice for the Southeast area, and I just want to say how wonderful it is to see this level of diversity. This was not expected, and it made me shed a tear when I got here, that's the truth. But I am a mother first of a young man living with mental health challenges. I'm a single parent, wrapping up a PhD program. And it has been extraordinarily challenging to navigate the maze on behalf of my son, which I will share later on. I need this one.
Good afternoon, everyone. My name is Prince Moses Osaje. I'm a LADAC, that is Licensed Alcohol and Drug Counselor. Right now, my title with Open Sky Community Services is Senior Interim Program Director. I'm glad to be here, and just like my colleagues have already stated, maybe as time goes on during the question and answer, maybe I have a lot to say. But at this point, I just wanted to say that the reason I believe that I'm here is the fact that of what people may classify as lived experiences. 10 years with Department of Correction as substance abuse counselor. For the past 11 years, I've been with Open Sky dealing with mental health. So I come with a background of dual diagnosis. Thank you.
Good afternoon. It's an honor to be here. It's Christian King. Welcome to Worcester, folks. Happy Black History Month. This year's theme is Black labor. And we know that's a labor of love. It's not just physical, it's spiritual. We know about the intellectual labor that we put out as Black folks. And it's something to be acknowledged. And it's something that's present here. You can see in the leadership, and we can see out there in the service providers. First generation American. I'm very proud of my family. Came from the island of Bermuda some years ago. And settled down here in central Massachusetts. And I also am very proud. I come from a family of social workers. My wife is a LICSW. My daughter's about to be an LICSW. I'm an LC. And they didn't get the memo, though. I'm like, you gotta love what you do. You gotta be willing to lift up others. And, you know, hopefully get a good compensation in the meantime. It's an honor to be here. Big up to Open Sky, Mass DMH as well. And I'm also, as mentioned, a social worker here in the city for close to 30 years. Also might be relevant to some of the state folks. I'm regional vice president of my union, SEIU Local 509, making sure that resources are there, advocating on the state level for that, you know, and making sure working people are placed in a position of prominence. So it's an honor to be here.
Good afternoon, everyone. My name is Maheta James. I work as the Assistant Commissioner in the Central Office for the Division of Child, Youth, and Family Services. I've been with DMH now for about 10 months, and it's really an honor and I think a true blessing to be in this position. I've learned so much from the area offices and the phenomenal area office staff in terms of how these staff really galvanize around community. Folks every day are thinking outside the box, thinking creatively, and thinking about how to be true partners to families and youth who are really struggling with significant behavioral health issues. And each and every time I have a chance to either visit area office or be involved in area office activities, I count it as a privilege because I learned so much from the staff. And so, although part of my job is to support services that are directed towards children and families centrally, both on a programmatic and policy level, again, I count it as a huge honor and privilege to be able to learn from everyone and understand just how impactful the work is that you do. And I certainly find it an honor and a privilege to be here today, celebrating Black History Month, coming together as a community, and within that community, representatives from all different walks of life, different races, different nationalities, who are coming together under a spirit of unity and love and really wanting to make change, even amidst a lot of negativity, as I think Jerry spoke to. So the energy in this room is palpable. Your spirit, your care and kindness, and thank you for having me today on this panel.
Thank you so much. So I know for the ladies on the panel, you have some wonderful stories to tell. And I know we can spend the entire afternoon talking about those stories that you have to share with us today. But I want you to take just a few minutes to help us, the audience, understand what your experiences have been in terms of navigating the maze, both as parents and professionals. What might have been some experiences that you have had as you try to navigate the maze of mental health, both as parents and professionals? And either of you can start.
Got it, Teresa.
You got it.
I love working with Sharon. You know, when I was listening earlier to Stephen speak, Stephen? Yes. I'm a note taker, so I'm always taking notes to go back and reflect. And I thought about how I navigated the maze through the silence, in silence. I remember that day like it was yesterday when I was getting together with a group of friends I knew and started talking, and I said, Teresa, are you okay? And I just had a moment where I just broke down and said, no, I'm not okay. In that moment, I realized that it was time to break the silence and let people know that I was suffering. My daughter needed support. I needed help. So, and it gets better because this story is like emotional at the beginning and then it's emotional again at the end, but then it's like, goes all over the place. It's the maze, it's the journey that never ends. You know what, I thought I was gonna be nervous today because I'm honestly not a public, like I don't really like speaking in public, but I realized that when I start telling this story, that if I keep it in silence, then I won't be able to share how powerful my journey has helped other families. So let me go back. So I'm navigating the maze in silence. I told my friends that I was suffering, not okay. In that moment, I realized I wasn't the only one. Actually, a lot of us hide things, right? I say maybe they're more like associates / friends. Okay. So in that moment, I realized that there were parents that were trying to help their children get services, and then it was three of us, or 3 or 4. And in that moment, I said, we need a space to talk about this. Wow, can we come together? And I said, I'm gonna start a support group called Parents of Purpose. We're gonna get together. And so I had 4 of those parents that was there with me at the time. And then before I knew it, I had over 20 parents showing up for this parent support group to talk about navigating through the education system, the prison pipeline that I heard today. And I remember my daughter being in 2nd grade and just struggling. I remember getting the phone calls, being at work. They're gonna call me, they're gonna tell me to come pick her up. I'm gonna have to leave work, I'm gonna have to change my schedule, I'm gonna lose my job. I have a house, I have this, I have that, I have this. And when I started advocating for myself, I would question the teacher and say, could you tell me what were some of the techniques that you worked with my daughter to give her the support that she needed so I don't actually have to come pick her up from school? I started questioning things. I started going to those meetings and knowing, coming prepared, having someone to come with me to help me that 15 minutes of X, Y, and Z services is actually not enough. As parents, we don't know what we don't know until we know it, right? So, and then I started, once my journey started to get a little bit easier, I started to be able to breathe again. I said, there are other parents that are going through this, and how can I help someone with their journey to make it a little bit easier? I started off as a parent partner, working with parents, and did that for 3 years, helping parents just to know about the education system, know about their rights. But through that, I realized that we are the experts. We know what our children need, right? And that has helped me along the journey. And my daughter now is a freshman in college, and she's doing extremely well. And I'm so happy that because I got the support, I got the resources, I was able to get those things in place that she can strive today as a 19, and like I said, she's a 19 years old, freshman in college. I kind of go on and on. So I'll stop right there so that we can have others be able to share. Did I answer?
Okay, I'll be brief. So I'm going to cover, as you all are, those of you who are DMH employees, it's important to understand that all Black people aren't the same. My son spent his formative years in the Caribbean, where there was no, oh, sorry, see, I'm so loud I don't even need it. My son spent his formative years in the Caribbean when I had a divorce that said I just decided I didn't want to be here anymore. I want to be close to my family. So I left and went to Barbados with my son. And then the person that was the most important person in his life died, my dad. And he started to exhibit some signs that were alarming. But being in the Caribbean, if any of you know, they do not have any kind of services for people living with disabilities in most of the islands, certainly not in Barbados. And so I brought him back. He was diagnosed with MDD, GAD, and anxiety. And so I'm now living with a young man as a single parent with mental health challenges I know nothing about. And trying to get whatever services I needed for him. And his first hospitalization was actually out here in Worcester for depression. Some girl broke his heart and he lost his mind and ended up in a hospital. Fast forward with the continuation of support, my advocacy was how he got what he got. Parents, you are the power behind your child. And so employees, case managers, supervisors, you need to recognize whether they're adults or children that the family has to have a seat at the table when navigating services for their Black children. Having said that, when they turn 18, by the way, they ain't grown. So if an able-bodied person, a teenager, isn't altogether grown at 18, someone with mental health challenges at 18, cognitively, they're not there 9 times out of 10. So just keep that in mind. Last year, he was doing well, Dean's List at Massasoit, doing all the wonderful things. He became dysregulated, had to pull out of school, got really depressed, and started smoking cannabis, which led to the presentation of cannabis-induced psychosis, or so it was diagnosed. It took 4 hospitals to get any kind of help for my son in a way that mattered. It was very different, and let me just say this too. 4 hospitals on opposite ends of the state. So you can imagine with the families that you're working with, if you go into the ED and they do a bed search, these parents don't have cars and you have to navigate over there to New Hampshire or Westboro. It ain't easy. So we need to do something about that too. But what was difficult for me, and I'll pass the mic in a second, what was difficult for me is that I'm in the middle of this crisis with my 23-year-old Black 6'4" son, and I work for the Department of Mental Health and did not get the support that I thought I should be getting, which brings to mind the question, are we doing as we should as employees of DMH? Maheda is here now, so I think we're going to make some strides forward, but but it was a struggle, and I'm here to speak truth to power. He's doing well now. He's doing better, I should say. But it has been a journey. As a parent of a black child in this political climate, still struggling, still has the stigma, and I'm an advocate for him, and he's now classified as an adult and they're trying to shut me up. That's not gonna happen. But we can talk about that too.
Your mic should be.
Okay. Well, I'd just like to start, I'll try to be concise. I really can't tell my story without sharing that I have a wonderful mother who I owe everything to. Very strong black woman who raised me completely on her own. I come from a family of significant generational trauma. Trauma including domestic violence, substance use, poverty, mental illness, and my mother made a decision that in order to raise me, understanding generational trauma takes a long time to work through. In order to raise me in a healthy environment, separation from many of her family was necessary. And so in doing that, she didn't have many supports. All that to say, coming up, watching my mother struggle, we needed to depend on many systems, sometimes just to make ends meet. And I remember my mother on the phone, I was about 6 or 7, with what we called the welfare office. We had missed a benefit check and my mother was trying to figure out why. There were so many loops she needed to kind of jump through to get benefits at that time. And I remember her on the phone saying to the person on the other end, you know, I hope you never have to go through what I'm going through right now. And if you do, I hope that person is understanding and kind. And she hung up the phone. And that always stood with me, and I think it was at that moment that I understood that if I was ever in a position to help others, and to be a voice for families, or for those who were treated differently. I didn't understand racism and oppression then, I was too young. But I understood there was something about my mom and our experience that made people treat us differently. And that really fueled my desire to be a voice and an advocate for people who are treated differently. And so, fast forward, got into social work. My undergrad experience was life-changing. I learned about structures of oppression and racism, and was also connecting the dots in my own life, and really fast-tracked my career in child welfare, where, you know, I had wonderful work experiences and built wonderful relationships with families that I worked with. All of that to say, I really prided myself, and I think it was therapeutic in a way, to now be working for the systems that worked against me and my mom, and to be driven by that mission of being empathetic and caring to everyone and every family and youth that I work with, no matter their background, no matter their struggle. And so fast forward, I got married, moved to New York, continued in my work in child welfare, was doing work with the Department of Public Health in New York City, had a beautiful baby boy, just was the love of my life, and was developing normally up until around 14 months. At around 14 months, it was like a light switched off. I would say, Selwyn, you know, that's my son's name, no response. I wondered if there was something wrong with his hearing. You know, he did have some medical issues, so we looked into that. I asked the pediatrician, do you think this is autism? Oh, no, don't worry about it. Anyway, fast forward, my husband and I, we knew something developmentally was off, and we had our son evaluated, and he was diagnosed on the autism spectrum with significant autism. And my world, I don't know, crashed. I felt isolated, I felt depressed. I remember the psychologist who came to our home and gave us the diagnosis. She evaluated him for 2 hours. She did what they call the Vineland. She pulled out a bag of toys, had my son play with them, did her assessment. She said, I want you to come into the living room. And she said, yes, he has autism. And then went right into, here's what you need to do. Here's the paperwork you need to sign. I didn't hear anything. Once the word autism, the diagnosis was shared, I shut down. And I can say, looking back now, I went through a significant depression. And there were a number of things that, looking back, I think would have been more helpful to me, and I know we'll get into that. But my depression was also triggered by the fact that now I'm going to have to rely on systems that I know have previously, I thought back to my experiences when I was younger with my mother, and seeing how much she struggled. And even though I worked for the system, now I was back in a system I was unfamiliar with and needing to rely on people and systems that had shown me, based on my own experience, that they could be harmful. And I felt lost. And so, although my experience is not a journey through mental health systems, I think our journey, is similar in that sense of feeling lost, mistrustful. I feared I would be judged. All of these people suddenly coming into my home, it was overwhelming. And I felt like I was drowning, to be quite honest. So I'll leave it there.
Thank you. Systems, issues that you talked about. So let me go to the gentleman and get them into the conversation here. In your professional experience working with people, individuals who are receiving services, what are some challenges that those families face as you, as professionals, try to help them? And Moses and Mr. King, you're wearing your DCF social worker hat now. What are some of those experiences that some of the challenges that the families faced as you try to help them?
So, I want to thank the powerful women and their testimony today. It's deeply impactful. I think to myself as a practitioner, I think to the folks here providing services and administration, so thank you. That being said, I think some of the barriers, which is what you're asking for, I think some of them have already been stated, right? So I don't want to restate them, but I will say, when it comes to the piece that you're talking about, the lack of trust, right? The lack of being heard, folks being aware of the context of the psychological, emotional ramifications of diagnoses or treatment and care. That's important. It's cultural competence and sensitivity, all kind of wrapped up in one. And I'll share really quickly. I got into, or came into, trying to help others after losing 3 friends to gun violence by my sophomore year in college here in Worcester. I was a pallbearer in 2 of those funerals, and I wanted to make a difference. And I knew that for young black men, often the way generational trauma and experience come out is more aggressive and violent than some other genders and populations. And so, navigating systems that you don't trust is huge, but also there's a whiteness that's foundational to mental health care. We see it as professionals in our licensure exams. We see it as professionals in the diagnoses and treatments that are there. And when folks educate themselves, when you have a loved one or you're providing services and you're trying to educate yourself on the symptoms and the realities of how to move forward, knowing that creates additional barriers because there's additional lack of trust. So, I can recall, there was a young person I worked with here in Worcester a couple of years ago who was diagnosed as having nonverbal autism from Angola. And the mother was illiterate in English and Portuguese. And the fear of getting involved with a government and a system was huge. And this gentleman, this young person, 13, about 6'2", 240 pounds, and would strike out at teachers and educators. But the fear that this woman had caused her to be labeled as neglectful, avoidant, difficult, opposition. Because while acknowledging where this person was from, there really wasn't a deeper dive into the context of why. And I know I'm preaching to the choir here for the most part, but that's something that repeatedly, becomes part of provider bias and inequality of care. And forums like this are extremely helpful. I can tell you that, I don't know if this is going to another question, but in the city of Worcester, we do some things that we connect with local towns, Shrewsbury, West Boylston, Grafton, through our Division of Public Health, and trying to address stigma and things of that nature. So I would just reflect back that, all the things that we've talked about here, difficulty navigating the process and the distrust is huge. I mean, there's a reason why, on the medical and health disparities, we see, for example, the maternal health outcomes for Black women, because the listening ear isn't what it needs to be, and there's conscious and unconscious bias that come into play. So
we're going to come to some policy
I didn't mean to jump around.
No,
Just came out.
That's okay. We're going to come to some policy questions a little later. But Moses, can you share a little bit of your experience working with individuals providing services?
I think because I think the question you raised was the challenges. Those of us who are, I use the word frontline, those of us who are working with folks with mental health. Most of them have been said. I remember when the two, Shakira and Stephen this morning, they highlighted some of those points. But it's worth re-emphasizing, it's worth saying over and over again, so that the BIPAC people should be able to get something and take away from here today. Somebody already mentioned stigma. The stigmatization is already there. That one of the reasons why we are facing a lot of challenges from the BIPAC people, I keep on using that word BIPAC, is that once you are being classified, I use the word classification, it affects a lot of people to come out openly to seek help. Another challenge that I know that I've seen personally is lack of education from the parents. Most of them are not knowledgeable about what mental health is. We know that if you are having a headache, your PCP is ready to prescribe medication for you or whatever ailment that you have. But people look at mental health as something that is not important or is not real. And what comes to mind is that you are looking at somebody who is crazy. I use the word quote unquote. Is he crazy? No. So those are some of the challenges that where you are trying to do your best as a professional. First and foremost, you may not be able, because if I tell you that I'm a little bit shocked right now, hearing from especially two of you, all the effort that you guys have made, and I wish, I'm just wishing, I wish everybody in the whole world is doing the same thing. I think our job will be a little bit better for us to handle. So lack of knowledge, education on the part of parental upbringing is there. People don't know that mental health is as deadly as every other sickness that you may have.
I know I'm hearing some of the same themes that we heard from the speakers this morning coming through in the things that you guys are saying. So we've seen the connection here and how wide and deep this really is. So let me ask, all of you can answer this question. What do you think mental health professionals and institutions can do to create a more inclusive and supportive and effective environment for individuals of color particularly? Any one of you can take this question.
I would say that we have to continue to keep meeting the families where they're at, making sure that we always take into consideration what they need, and be patient with them. When I think about families and we're measuring like how engaged they are, to really think about that when we want them to go to the team meetings or meetings and they're emotionally drained and they can't show up, when they have to cancel or they're not showing up, to really go back and look at, it's not just one challenge they're facing. It could be housing, it could be financial needs. So how do we address some of those things that that's really pressing for them, like securing housing and food first. One of my passions is making sure that families have resources. Once I started getting the resources that I need, I kept sharing because I knew it was important that if you had the resources and you knew about different places that I tapped into, like City Mission and Family Ties, and I can go on, those are the organizations that help me get through my journey. And when I'm in meetings, I'm always taking a step back and say, what do the families need in order to keep going? If it's not just a phone call, are we being creative about how we're meeting families? Can we go to a coffee shop? Can we, if I mention like support group, no, they don't want to go to a support group. Okay, well, will you go with them? Or maybe there's a workshop that they may want to go to. How do we help families? Because sometimes they say no, but it's really not that they don't want to do it. It's just that it's a time that they just are overwhelmed. So how do you go back again and revisit that? I think one of the things that I think families have appreciated with me is that I didn't have like a set format of how I was going to work with families. I just showed up and really just said, you know what, how are you feeling today? You tell me what you need. Do you want to talk to me today? You want to talk to me tomorrow? Choices is important, that we give families choices. And be candid, be transparent. I'll say this really quick. I went to the ER the other day, and we know how the ER works, right? It goes by first priority. One person over here with a hands bleeding, I'm in pain, shooting pain, and someone else has the flu, I have to wait my turn, right? So I get there at 6 o'clock, 7 o'clock, 8 o'clock, they'll call me. Whew. But I realized that in the moment when I was even in the ER, of how we're all in this room and we have one thing in common. Well, we have a couple of things. We're pains, this, that, but we were waiting to get served, right? We were waiting to have the doctor come out, waiting to go in the back, because they trick you with the check the blood pressure, then you come back out again, you can plan to sleep. I want to go to the room, bring me to the room. And then you get to the room and then you gotta wait around again. And so, but in that moment, I was like, wow, this room is filled with people that need help. Remind me so much of the families that we serve that are dying for help, support. And once you get that support, it's like that Band-Aid, right? You get that Band-Aid on, but then you realize like, ooh, it's not really healing right. So we have to go back again and make sure what else needs to be done to really get that wound healed. And I think families will always, we know that they will always have something, but we can just keep making it a little brighter, give them some hope, build their confidence. A lot of families also come into meetings not confident. They're looking at professionals that think these people know nothing about me. So I would even go to work. I wouldn't go with business attire. I went in with just regular clothes on because I never wanted them to think that I was showing up and that they had to be a certain way around me. I wanted to really meet them where they're at. So I'll leave it at that too.
When I started speaking a couple minutes ago, I started by saying all Black folk aren't the same. What do I mean by that? When our kids are in middle school, high school, there's something called the pipeline to prison, where you are misdiagnosed with a behavioral problem as opposed to a mental health problem. Coupled with the fact that we have people from around the world go into our schools, because you don't need to show status, you don't need to do any of that stuff. But in other parts of the world, there's no such thing as mental health. It is a stigma. They're put in a hospital over here and left to die, right? So to piggyback on what Teresa said, in meeting families where they're at, you really need to meet families where they're at. Don't assume that because they're not engaged, it is because they don't care. It may be that they simply don't have the knowledge. A lot of kids that I worked with in my previous federal person life, kids were finally diagnosed when they got to prison. Before that, they did not have any kind of access to what they really needed. And you as the experts, and I'm going back, shout out to case managers, you have the key in making sure that families, when they're, and you know, we're CYF, but CYF will become adults. They need that intervention early, the earlier the better, and TAY age, right? Transitional age youth are not adults. I implore you to encourage families to stay the course with them as they will, you know, the kids will become adults eventually, but they need that additional support. They need proper diagnosing, they need proper medication, they need to be in hospitals where families can access them. You cannot have a mother with 4 children or a grandmother raising 4 children. One of them is in a hospital near New Hampshire. How are they going to take care of the 3 and then be part of whatever family engagement thing that they are supposed to be involved with? Or I'm going to call the name of a hospital, Westboro, where you literally have a half hour for visiting, period. So I live in Dorchester, my kid is in Westboro. I have to leave work and lose my job to get to spend time with my kid from 2:30 to 3, and you spend 15 minutes being patted down. Then the kid comes down, you spend 5 minutes, and then they say that it's the parents' fault. We need to meet, when we say meet families where they're at, that's literally there's nothing wrong with asking parents questions. They may not have English as a primary language. Find somebody who speaks their language. They're from all over the world. We need to meet family. That's the only way, or one of the ways, in which we can make a change in Black families' lives as it relates to mental health.
Let me switch that question, shift from that question so we can keep me on track there, Levi, as it relates to time. Let me come back to Mr. King and Ms. Mahia in terms of policy. What are some things, Mr. King, from your perspective in the City Council that is being done? I know you started talking about some of these things that the city is doing, and from DMH perspective, what are some policies that are being put in place to make sure there's equality and equity in terms of delivery of services for all people?
Sure. On the city side, you know, which includes our Worcester Public Schools, we do acknowledge mental health. That's important for our youth. We've done a good job of adding more, I call them school social workers, but adjustment counselors. There we've added climate control specialists, and I'm very proud to work with Black Families Together, getting I'm sorry?
Elaborate on what that
on
is.
What?
The climate control
Okay, yes,
specialist.
sorry. Climate control specialists are people from the community that come in to address issues with young people instead of having police officers there. So we were paying around $1.2 million in our high schools for police officers who didn't have the training, don't have the expertise, the licensure, or the community experience to de-escalate our youth. So I work with Black Families Together to get that changed, and the City Council eventually, and it's had great results. In addition to that, the public health works in coalition with Healthy Greater Worcester, which I mentioned is the surrounding towns. And you know, we focus on supporting youth through a program we call HOPE, Health Outcome for Positive Experiences, that builds capacity serving our youth. I do want to speak quickly, just I know, going back a little bit to some of the women we're just talking about, is when I mentioned the young person from Angola who was diagnosed with the nonverbal autism, 6'2", 200 and something pounds, and he had been physical at school. And I wanted to speak to the importance as practitioners, as administrators, as upper management, that you have to be comfortable with your colleagues' discomfort. You have to be comfortable with your colleagues' discomfort. Because in that instance, I made people uncomfortable when it brought to their attention, mother's actually afraid that they keep calling the police on her boy, and he may not live. Not only is he going to be labeled, he may not live. So I'm not bringing them anywhere. I'm not bringing them to any institution where I can't have access to, because I don't know what that really means. And yes, the African diaspora is real, right? They have that same ship, different island. It's a real thing, so we're not a monolith. But there's some commonalities there, and part of being uncomfortable is if you're working for a nonprofit, if you're working for the state, they tell you separation of church and state, which is true. However, depending on who you're working with, that religious component is huge. To be able to connect them and validate their priority of pastoral counseling or some other form of counseling gets you to improve that clinical bond, that relationship, which helps move everything and helps them accept diagnoses that are seen as weaknesses in some instances. So I just wanted to say that. I know it's a little bit all over the place.
That's all right.
Apologize, but yes, this is important stuff.
Yes, thank you. I'll say a couple of things. First, I just wanted to encourage us to think about trauma-informed care models that we're all familiar with. And when we think of trauma, do we think of racial trauma as a part of that paradigm or model? How many of us, I can think back to my years where I was proud of the work I was doing in child welfare. I can't remember a time I sat down with a family and said to them, what's your experience like in this system? Do you ever think about how racism has impacted your life, giving families an opportunity to actually talk and explore racial trauma and its impact on their life? I don't think as a system, in terms of our behavioral health systems, we're there yet. And so I would love to see as a system trauma-informed care models that incorporate discussions and exploration around racial trauma. I also have to say that I have just seen some phenomenal work. I'll speak from a policy lens in just a minute, but I was in the Southeast and was just having a conversation with Alexis around being aware of our own unconscious bias. We all have it. We all have it. You cannot live in today's society without having a level of bias. And so the key is is developing a lens that helps you catch it and understand it so that it doesn't have a negative impact on your interactions with whoever with the community and who you're working with. And so I saw a checklist that was developed by someone on this panel, looking at you, Sharon, that helps at each engagement as you're thinking of a family and their family history and you're thinking about how do we make inroads, how do we engage, incorporating that unconscious bias checklist into your kind of natural progression of treatment planning, being aware of yourself. I think that's critically important. And so for more of a policy angle, and so just again, want to uplift that the area officers are doing a phenomenal job thinking about this centrally. You know, we have, I think, more of a focus on policy and implementation. But the area offices are doing the work and they're thinking about this on a daily basis, and I've been so thoroughly impressed, especially around the work of the area offices, but hearing conversations that the directors of family-driven practice are also having has been really encouraging. But fortunately, I'm in a space nowadays where I'm trying not to get consumed by negativity and trying to count my blessings, as my mother would tell me. We are fortunate that we're working in Massachusetts right now. And we have a governor who has implemented an Advancing Health Equity in Massachusetts plan. So this plan really is two focuses. One is on maternal health, and it explicitly names and identifies the issues with Black mothers and maternal morbidity rates. But it also, the second prong really focuses on social determinants of health and understanding how social determinants of health, things like racial, race, economics, have a direct impact on your physical and mental health. And so this project, again, Advancing Health Equity in Massachusetts, is referenced as AHEM, and anyone could Google it or look it up online, and you could find more information about that policy and practice. And then I also want to mention that in terms of the Department of Mental Health, we have, we're playing a major role in implementing the Office of Behavioral Health and Prevention, Behavioral Health Promotion and Prevention. And I just want to read, I was just pulling up, it's just being developed, but it's a legislatively mandated office. Here's the statement around health equity for this office. We're committed to ensuring fair and just pathways for behavioral health promotion and prevention initiatives, centering those with historically marginalized identities, including people who identify as Black, Indigenous, and people of color, so BIPOC folk. People with disabilities, people who are incarcerated, veterans, LGBTQ+, and non-English speaking individuals. We are prioritizing accessibility, timeliness, affordability, cultural sensitivity, high quality initiatives, and the list goes on. So that is another thing I'm grateful for, that we're working in a state that is still calling out the fact that there are racial disparities and creating policy and planning to address those.
Thank you. I was going to ask if there are things that all of you would want to change in terms of the way services are being delivered, mental health services in particular being delivered. But you mentioned Sharon's checklist. Would you feel comfortable telling us why you started that checklist? What prompted you to start that checklist?
Because we're in the Southeast and it ain't diverse. And so there is implicit bias with folks, providers, and some of our, our team. And so, like you said, right, you have to be comfortable with making people uncomfortable, which is why, they don't like me too much right now. But that is just the reality. We have to be prepared to have those hard conversations, because the beginning, middle, and end are about those who are asking for our help with services for children, transitional age youth, and adults. That's it. That's pretty much it.
This is not a response to the question you posed. I just wanted to add something to what my dear sister said a little while ago. That indeed, those of us who are in Massachusetts, we are supposed to be grateful to the governor of this state. We are lucky to be in Massachusetts. And secondly, I want to give a shout out to my organization, Open Sky Community Services, especially with the CEO. And I look around, I discover that I have about 3 or 4 VP who are here today. And when I was asked to come and speak, I wasn't expecting them here. So it's a great shout out to all of you that who decided to attend. For the past 4 years, they have been in the forefront advancing race equity in that organization. The reason I decided to say this is that those of you who are here, whether from DMH, DPH, whichever organization you belong to, please kindly continue to promote DAIB in your organization, because a lot of BIPOC people are suffering in silence when it comes to mental health. Because one of the most difficult things that they experience is what we refer to as cultural competency. Is we don't know how to cry out when you have somebody who is suffering from mental health. We don't know how to, because it's not part of what we do. When I use the word we, and you can hear from my accent that I came from West Africa, Nigeria in particular. And I've been here for maybe doing this job for about 25 years of my life here. We know we can come out openly to express to folks around us that, oh, my child or my kids is unheard of. So I'm appealing to all of you here. As I said earlier, I could care less which organization you belong to. But I believe that in every organization, in every agency you work for, there is folks that need services, especially the BIPOC people. Thank you.
I just wanted to, I'm not sure if we can get to it. I want to make sure I validate and uplift the impact of what's happening via executive order in this country, in this Commonwealth, and trickling down to each and every one of us. We know that people are less apt to access services right now. As public safety components, they're less likely to report domestic violence. They're less likely to ask for help for someone who's suffering from mental health in their hiring practices, which has a great impact on the community here in Worcester and beyond. But that you ask for data. Ask that your supervisor, or if you're a manager, administrator, assistant commissioner, director of area offices, try to collect the data. Because disproportionality is real in terms of service provision, where you live, where it goes, what the diagnoses are. In my world, who's getting involved in juvenile court, the trauma or school to prison pipeline, and all those things are important. Policy, the funding, you got to show up. I know politics isn't a great thing. The way I got involved is I was showing up on Beacon Hill advocating for more services for kids and families, right? It's all funding. We have a governor who's doing that, but you have to show up and stay involved. So collect the data, and all these things we're talking about in practice, from case management, family involvement, it's got to be reflected back in the policy. It's got to be reflected back in the policy of your private sector job or your public sector job. And all of us can have an impact on that by simply asking the questions and asking and nudging and urging folks to move in that way.
All right. What things you want to change in terms of delivery of mental health? What things, and this is a question for everyone, what changes do you want to see happen as we think of supporting, disenfranchised and underserved families?
Yeah, you think about infrastructure, right? Transportation, access to transportation, reliable transportation. We have our cities, which are hubs of services. How do they get there? How do you get to visit your family member? It's unreliable, and it's necessary to get the services that you need. The backlog and the wait list. Fortunately, we have more people coming into the profession, and there needs to be proper compensation for them to retain those employees in these jobs. It's extremely important. And then lastly, and this is a larger political thing, the livable or minimum wage, right? If you have to go and attend, you're working, you've made life decisions, you've ended up in a certain place, or you've gone through generational trauma, you've ended up in a certain place. You have to get to the appointment. You have to be with your child or with your adult person that you're taking care of, or your guardianing. But you're making minimum wage in this economy with issues with housing. We need advocacy from people like you guys to push that forward because you can't afford to go. Where are the parents? Where are the guardians? They can't afford to be there. Now we have all other sorts of issues, right? Of neglect and et cetera, et cetera. So if I had the magic wand, transportation, funding, and a larger pool of resources.
All right, before Ms. James answer, let me just tie that question into a final question so we can just wrap up, because I'm looking at the time. We want to give the audience a chance to ask questions also. So the original question, and then in that, can you give some final words of hope, things that you're hoping for as we move forward? And that question goes for all of you as you wrap up. Just want to give you, a few minutes to say some final words and things. What we're hoping for out of this event and in your work as we move forward.
Okay, so to answer
What would you want to see change?
Yeah,
What changes?
the first question. I strongly believe we need a different type of training in terms of helping folks understand racial equity and inclusion. It was no coincidence that the same year my son was diagnosed with ASD, I was diagnosed with hypertension. All the things I was worrying about raising a non-verbal black male in society who, I think at this point he's slated to be about 6'3", when he, so he's going to be a big guy, and he's partially verbal. So, I've never been asked, by any of the social workers that I've worked with, what are your fears as a black mom of a son who's partially verbal? What do you worry about? It's like a, what do they call it? The pink elephant in the room that nobody ever even addresses. Racial trauma, racial considerations, racial worry. Clinicians need to be trained up a little bit better in terms of how to address those issues. And then in terms of a message, look at this room. We're all here, sitting in this space, where we all look different, we come from different backgrounds, but we're here for a reason. And it's time to dig into community and dig into the commitment that we all share. It's time to show each other kindness and really lean into what's important. And that's taking care of ourselves and taking care of our communities and the populations we serve. And so, time and time again, I think humans have shown that they can promote change even if what's going on in the world is crazy. And I shouldn't use the term crazy, but negative. And so I would just say tap into that and actively resist where you need to and show up for families.
And I'll keep it brief, I already spoke, I would say black labor will win. We've always won, we'll continue to win, but it does take the collective labor of all, intellectual, spiritual, emotional, physical, show up and show out. That's extremely, extremely important because it's not over, we're just beginning. The cavalry's not coming to save us. And black labor knows that we never bend the knee. Do not bend the knee. Make people uncomfortable respectfully in the workplace and fight for the right policies and funding.
I think my recommendation is very simple. I would say we should do a lot of improvement on crisis intervention. We should pay much greater attention to solving the problem instead of looking at jail term.
Dear DMH leadership, this is for you. Please understand that those in the front line deserve your respect and admiration. Case managers, y'all notice that I've been talking about case managers? None of them should be sent anywhere but into the community to continue to serve people like my son, her daughter, and her son. DMH is the authority, apparently, on all things mental health. Therefore, show the team that you agree and you do your fighting to keep everybody here. And a salary increase wouldn't hurt.
So my hope is that we continue to have spaces just like this one today, that we come together, keep working. We can't do this work in silos. One of the things that I really enjoy is being out in the community. Know the community, the families that you actually work with. When I'm out in that community and families are coming up to the table, I'm not standing behind the table. I'm actually going to the side, really meeting them where they're at, come over. There's so many families that don't even want to come up to the table, but come on over. I know it's okay. And really going out your way to help the families. It's hard out here. And resources, networking. I love to network. So it's great when you can partner. You don't have to do this work alone. There's a case manager meeting I just started, so I meet with the case managers that I work with. They need support too. So we spend that time to talk about the things that they have going on. Well, sometimes we want to say, are you okay? Okay, you're not okay? Okay. You don't want to talk about it? Okay. You don't want to talk about it? No, it's okay. But just knowing that they have a space too, because how didn't you go back to do the work? We got to fill our cups as well. So again, yeah, just keep networking with each other and supporting each other. And I encourage people to go out in the community too, to really see like what these families are going through. It's one thing when you're meeting them in the office or your home visit, but just some of these communities are so, from the time they get up in the morning, hearing the ambulance, the gunshot, everything that you're hearing, it's like, that's trauma before they even get to you to then say, how are you doing today? And I'll just leave it at that. I think that's enough for now.
Thank you so much. Let's give our panelists a louder round of applause. Ms. Teresa McIntyre, Ms. Charlotte Sharon Tate, Moses Asaji, and Mr. Christian King, and Ms. Maida James. Thank you so much. You can sit down because we want to give the audience a couple of people just some quick 2 or 3 questions or comments, and then we will wrap up. I don't want to lose the opportunity to give the audience a chance to speak.
Thanks, Ryan. My name is Carrie Noseworthy. I'm the Director of Family Driven Practice here in Central Mass Area Office. Thank you for such a phenomenal panel and day. I'll keep it brief. It's more of a comment or something that I'm thinking about. Not so much, in my role as well, but in my lived experience piece is, and this is more towards, I guess, upper management and leadership. How can we work in the 5 different areas to find things that do work well, like Sharon's checklist? How can we do better at providing consistent services like that aren't necessarily like RFR service, but we're 5 different areas. There are certainly things that are different, but I think when we find things that are correct, and I hear this from families all the time, especially ones that move, and I know we all hear this, are complaints that things are different in each of the areas. But I truly feel that when it comes to both civil rights and safety, when we find things that work with regards to civil rights and safety, they should be implemented in all areas. So I'm just planting that seed. Thank you.
Any other questions or comments? We have one in the back, and then we have Mr. Manny up front here.
Hello everyone, my name is Anne. I am a student for mental health. I'm currently doing my bachelor's in mental health in Bay Path University. I am also an LPN that works in a mental health facility here in Worcester. I work with young adolescent children who are experiencing behavioral issues and mental health issues. My concern, being a mental health student, here in the building today we have DMH, the Department of Mental Health. We have people who work in facilities, like Open Sky. You have a lot of people who are experiencing different diagnoses. I also work with individuals who experience substance abuse in the community and the homeless community. My concern, sorry, I'm nervous. My concern is the return patients that we have in our facilities. I have come to see that we experience the same individuals over and over again. Yes, we are talking about solutions. Yes, we are creating avenues where people can get help. But why am I seeing the same patients over and over again if we are talking about the resources that we have in our communities? Are we following up with our patients? What is DMH doing to make sure that we don't see the same patients next month? Are we going through the same steps that we have talked about today? And how can we make sure that we are following up with the students that I see every single day because of behavioral issues? I believe today we have talked about very profound topics that are necessary in our communities. However, I feel like there lacks follow-up, and how are we going to fix that in our communities? Because once they leave my office, I will never see them again. Once they leave the case manager's office, I'll never see them again. They'll never see them again. The clinician office, the same. If DMH, if Open Sky, if all the other facilities are not able to follow up with our patients, then how will we continue to fix these issues? Because I promise you, and I kid you not, we are having a repeated admission of similar patients and clients. And how are we going to fix that?
All right, thank you for that question. Any one of you want to take that question? Naeli, you want to take that question as CYF?
First of all, I want to celebrate you as being a mental health student and being so concerned about the community. So thank you. I think the issues that you just raised are all just significant, such important issues. As we continue to learn about mental health is nuanced. Some individuals have more chronic diagnoses where they sometimes do come back to our systems needing help after stabilizing for a period of time. And so you have that population where we've come to understand that sometimes people need more acute care, and then they're able to kind of go back in the community and stabilize. And then I think there are also other concerns and issues in the community where people are seeking services through emergency rooms, experiencing significant behavioral health crisis, and they go to the emergency room and that's the first time they've ever sought help. And so we as a system really do need to do better, I think, at creating front doors to individuals so that they can get the care, culturally attuned care, and support that they need to offset any need to be for urgent, emergency room visits, or where they're experiencing a behavioral health crisis. We've got to do better at doing the prevention piece. And so, love to get your information, after this, just to stay connected. But I'm hopeful for some of the work that the Office of Behavioral Health, Prevention and Promotion will do in thinking about the very, those individuals that you raised concern for. And I'm even more excited about, I think I mentioned the model of advancing health equity in communities.
So I'll first begin by saying this is a we, us, and them issue. It's a we, us, and them issue. And, I listen to black political radio. There's a gentleman who passed away, Joe Madison, called the Black Eagle. What he would say is, when these issues come up, what are you going to do about it? What are you going to do? Now, what I heard from the question was that there's some recidivism, some repeat folks who are coming back. And it goes back to what I mentioned before, data. Ask your agency to track, to use data. Who's your state rep? Who's your senator? All comes down to funding. Perhaps there's another service model that would be helpful. but you're not going to get the funding for that without data and without tracking. You can start that just from asking. You know, you can manage up in some instances. And we know that there's a confluence of factors. We know that in some instances there's a lack of psychiatric beds for our teens and our youth, and they end up in different places, or they stabilize, they go back home, then they're back in another program. There's a whole host of reasons. But the importance is that we have to find ways in our different areas of expertise and our different roles, the different levels of care, to track the data, reach out to your state elected folks. They love coming to meetings. Just invite them. They'll work with the other stakeholders to try to figure it all out.
Let's get Manny's question, then we have to wrap up.
Can you hear me? I'll try to be quick, and I won't try not to get emotional, but I thank you to all the panelists. I feel like everything you said, I like either agreed or could like 100% relate to it. And it was really impactful to hear. And I mean, I'm a first generation American also, I think like one of the panelists. And you know, trauma is induced, I don't know what they call it anymore, induced psychosis from like marijuana. And like I've been in and out of hospitals, and I'm working as a peer specialist now at the Department of Mental Health in Central Office. And I'm so, like my mom is like so incredibly proud. I've been doing this for 10 years. I was able to finish my bachelor's degree. And if it wasn't for people like in this room right now, I wouldn't be here. So like, I do believe that this, like, it's difficult to navigate the system. My mom didn't know any English. She's trying to get help. And when you were saying, Teresa, like you were worried you were gonna lose your job. Like my mom told me that so many times, like I gotta go take you to this appointment. But it paid off. And she didn't give up on me, and neither did the people. I mean, I went to Job Corps. It's like an untraditional school, and like the people there were super supportive. And I went to an untraditional school that had unique sort of student success centers, so that you know we didn't flunk out. And like it was people are working to design programs that fit people that look like me, and that is very warm, because all the crap that we go through is enough to break your heart. And when you hear it and you hear it over and over again, you could really get stuck there. But it's nice to come to something that's uplifting, so we could talk about like some of our solutions and what we're doing together.
Thank you so much. Put your hands again.